Hello, I'm Dr. Maurie Markman from City of Hope, and I'd like over the next few minutes to talk about an absolutely fascinating paper which recently appeared in the Journal of Clinical Oncology Clinical Practice, entitled "The Right Dose: Results of a Patient Advocate-Led Survey of Individuals with Metastatic Breast Cancer Regarding Treatment-Related Side Effects and Views about Dosage Assessment to Optimize Quality of Life." This is, again, a very, very interesting analysis. So this organization, Patient Advocates and Medical Oncologists, the group entitled the Patient-Centered Dosing Initiative, conducted a survey of women with metastatic breast cancer regarding the patient's treatment-related side effects. They surveyed 1,221 patients with metastatic breast cancer who completed the survey. Some of the highlights that they noted: that 86% of the women reported at least one significant treatment-related side effect, of whom, that group with the reported this, 20% reported at least a visit to an emergency room for that. So these women experience side effects. Many of them experience them. But the conclusion of the analysis was as follows. So the question was asked about dosing. Now, these are women who obviously received therapy for their metastatic breast cancer. 53% stated they did not believe that higher doses are always more effective than lower doses. And most importantly, 92% of those surveys said they were willing to discuss flexible dosing options with their oncologists based on personal characteristics and quality of life considerations. I think this is a very important survey summary, basically emphasizing that, we as oncologists very appropriately use the data. We use the data from clinical trials, whether they're prospective clinical trials, registration trials, or other trials that are reported in the literature, to make recommendations to our patients. We pick dosages based on what the data show in those trials. And what this survey suggests is that obviously patients don't reject that in any way, shape, or form, but perhaps, just perhaps, when you then add in the risks, the patients may say, but if you lower the dose, would that risk be lower to me? And maybe that'd be something that I would be interested in considering. Again, no conclusions are drawn here, but 92% of the patients who've gone through the experience said they would be interested in discussing the question of flexible dosing with their oncologists. For those of you, obviously, practicing oncologists, those interested in policy, those who are interested in patient-reported outcomes, this is a very interesting and I believe an important paper, and I encourage you to read it. And I thank you for your attention.